You don't need me to do this for you. You just take your hip through 3 different ranges of motion here. The first is, how much flexion do you have, right? And you can do this yourself, again, by grabbing onto your knee and pulling up. And for Jesse, he's actually got good flexion. He can get well past waistline, and it doesn't feel hard at the end. You want to make sure it's not feeling like it's running into a wall, but that it has some bounciness to it. The next thing is you want to check internal rotation. And even though the foot's moving that way, outward, the hip is actually going into internal rotation. You want to look and see how much rotation can you get here. 30 or 45 degrees would be great. And Jesse's actually got good rotation. And again, you don't need me to do that, though it's easier. You could do that yourself just to sort of test that. Then we have to go into external rotation. And in external rotation here, we're going this direction. And what I'm looking for is if this lower leg can kind of cross your waistline. Be parallel to your waistline. Run east and west. And a lot of you are going to probably find that you're going to have some restrictions here, right? But if you find that you have this restriction, really hard end feeling, restriction to internal rotation, significant, and also combined with some of this flexion limitation here, that would start to indicate to me you've got some bony arthritic changes going on there, or you've got some type of impingement or a labral tear, or maybe even a bursitis if you have some pain. And those are cases, all instances where you want to go get checked out for something that needs a little bit more qualified medical attention there, because that's not something you're going to fix here in a single video, right? But when we see the restrictions, when they're coming more from what we're going to find in this video, more capsular restrictions, things that you can do something about, you're likely going to find that the restrictions come in external rotation. And that's exactly what we find here with Jesse. You can see that his external rotation on this side is nowhere near getting to waistline. He's nowhere near parallel here to his waist. He's not running east-west. He's got all this lack of external rotation. So we need to try to figure out what is happening here. And we're going to look at the skeleton.